Welcome back. I'm your host, Dr. Bob Lee from BLS. Welcome to Open. How do you say it? Abierto. All right. Hey, on June the 3rd, Morrisania Band Project they're going to be holding their benefit to raise awareness for sickle cell disease. And joining us, we have the details, Elisa Carmona and Dr. Cassandra Dobson. We welcome you guys to the show.
Thank you.
Thank you.
You with QScan, right?
I'm the founder of Morrisania Band Project.
Yeah.
But I have a partnership with QScan that goes back from 2014 when we did a community walk at Crotona Park, and these were the Find the Cure for Sickle Cell bracelets.
Yes.
And so I was fortunate that Gloria Rochester of QScan was willing to collaborate again. Now this one would be a musical event. I'm a musician.
Great. Can I come by and sing? Is it Doctor, you're laughing at me. I can sing.
I hear the voice.
La, 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 la.
We are always recruiting musicians.
Yeah, you're recruiting. Now, Doc, you're with QScan. You're on the board, right?
I sit on the board for QScan.
And you're also a professor here at
I'm a professor at Lehman College, yes.
Right.
Yes.
There you go.
Since 1996, I've been with Gloria Rochester, actually.
Oh, okay.
Yeah.
So how did you guys meet? How did you guys come together?
Go ahead.
Well, from our event in 2014, this was sickle cell disease awareness is a personal focus of my family.
Yes.
We have a close relative that lives with the disease, and so to be a support to her in September, which is Sickle Cell Disease Awareness Month,
yes.
We hosted a community walk, and it was hastily put together. And so I said, hey, we need to give this thing some credibility, and I did a Google search, and QScan is the New York State chapter of the Sickle Cell Disease Association of America, and so when she agreed, Ms. Rochester, I was like, yes, and she came out. We actually sent in a picture. A lot of people showed up. We walked through Crotona Park, and during that time, people passing by stopped us, and when they learned of the event, sickle cell disease is one of those things that everybody knows somebody who knows somebody with it.
Yes.
And so people were coming up to us. So I felt like this musical event is long overdue. It's a follow-up.
Yeah, I remember we did something with Gloria and QScan. I think it was a block away from the UN. We just wanted to create the awareness because it's a worldwide thing.
Yes, it is.
Are you dealing with?
I don't personally have it, but what I believe that this event will show is that it's important to support people, families even, that are affected by this disease, because it's not just the individual, it's the family that, has to live with them, see them go through their crises and their ups and downs.
Yeah, I know a number of people that are dealing with it. Doctor, tell us, for those that don't know what the sickle cell disease is.
Sure.
Tell us a little bit about it.
Right, so sickle cell disease is a recessive autoimmune disease where you need to have two parents with the trait or the disease for a child to then have the disease. From that, the disease affects the hemoglobin, which is the red cell. As a result of that, the hemoglobin goes throughout your whole body. So once you have a deficit in the hemoglobin, it causes problem. The biggest problem is that there's a decrease in oxygenation. Once the cell gets deprived of oxygenation, then there's certain things that happen, such as clumping of the cells, sticking together, forming huge amount of complication in every single organ, including the brains, the lungs, you name it, the heart, the feet. We have something called the hand and foot syndrome, where the hand gets edematous or swollen to the point where it is so excruciating painful that patients are not able to use their hands.
Yeah.
We also have priapism, which is for the males, which stop the circulation to the male organ, causing it to become necrotic or necrosis and causing death to that part of the organ. We can go on forever. Just think of every organ in your body. Once there's a sickle cell patient, that organ can be affected.
Yeah, and it's very painful.
It's extremely painful because just imagine there's no blood going to certain part of your bodies. If the blood stopped going to your brain, you have a stroke. If it stopped going to your lung, you have acute chest syndrome, and it goes on and on. We have multiple complications with patients with sickle cell disease.
And how do patients combat that?
the best thing I go around trying to teach patients is they must know the disease themselves, because I am finding that healthcare providers don't know about the disease, and so there's a lot of trial and errors. And if you're just that bad lucky patient that wind up in a hospital where doctors are not familiar with who you are and what is going on within your body, you can become statistics, if you may.
Yeah.
So educating the patient is a primary goal.
Education, education. And most people, I have a friend that, they didn't think he would live past a certain age, but he's still doing some wonderful things. They just adopted a wonderful family,
I know who he is.
a boy and a girl, and they're taking good care of them, and they're very happy about it. He always wanted to do that. He couldn't have children of his own. So you have something coming up. Tell us more about that.
Yes, on June 3rd at 7 p.m. at the Dreamyard Project, we will be hosting our first annual musical awareness event, kind of like to empower as well as to educate. And so we invite you to come on through. We will, serve refreshments. That's from our first event. That was September 27, 2014. Through Katona Park, and we had a great turnout. And so we're looking for the same turnout on June 3rd.
And what do you need help with? You need cash, you need funds, what do you need?
We could always use cash. Well, we had an IOB Healthy Neighborhoods Challenge going on. And we are still accepting donations. You can access it through my website. However, I do have to...
Take that cap, take my friend. Say hello to my little friend.
Hi. Our
website
is www.Morrisania Morrisania band, one word, .wordpress.com. But I do have to report that as of last night, we've reached 100% of our fundraising goals.
All right, so we don't need any more
No,
money.
we can. Oh, this is why we.
Okay.
Q-Scan and I are looking to start a scholarship.
Yeah.
We are still planning what these monies would be used for, whether it would help individuals.
You can always use, you can never say no to money because there's always something that you want to do with it.
And just to interject, sickle cell disease receives the least funding from the government. We receive less than cystic fibrosis. We believe it's a race issue, but we try not to focus on that. People with cystic fibrosis gets more money, and there are less people in the world that has cystic fibrosis, and that affects mostly Caucasian. African American is mostly affected with sickle cell disease. However, it's a global disease, and you'll find that there's many different kinds of people that have sickle cell disease. But I think the stigma that is with it is that it's a black disease, and we need to get away from that so that the world know it's a disease that affects all race.
Wow.
They say something like 3.2 people worldwide. And in New York State, the numbers are unknown.
We're unknown. That's why we're doing the Let's Get Connected.
Yeah.
You can get on the website to do that, get connected if you know someone, or if you are a person with sickle cell disease, and tell us who you are, because we still find that we have not identified all the patients that have sickle cell disease, so we don't have the count to say that we need the funding.
I mean, there are people there that they think it's something else.
We find patients like 40 years old finding that they just have sickle cell disease because there's a specific test that you must take to find out if you have sickle cell. So some people feel aches and pain and, fatigue, lethargic, and they might just think it's a cold.
And they'll just go lay down for a little while.
And lay down and feel better, and it's a sickle cell crisis sometimes.
Yeah. Wow.
So.
Wow. Yeah. And they think that's just a normal way
just a normal way
I
of
got
living.
a headache. All right, let me lay down for a little while.
Yes, and we find some patients, when they come in, they have a lot of what we call mini strokes. So they've been having these headaches that they think is a headache, but they're having mini stroke as a result of circulation deprivation.
Yeah. So what do you tell these patients? How do you get a hold of them?
I think everyone should be tested. We go out and we talk to the community all the time and do the test, which is called the hemoglobin electrophoresis test, that can diagnose whether or not you have the disease. And we just continue to do our work in the community, walk up and down blocks on Saturdays and all the time to do what we need to do to get patients tested You know, and we try to look at a patient, and as soon as we see the yellowing of the eyes, we said, come, let's take this test. You might have something.
Jaundice,
Okay.
jaundice sets in.
Yes, that's one of the primary observation that we can see right away.
Yeah.
And the sickle dex is another test, but it does not tell you whether or not you have the disease. It tells you have an abnormal gene or an abnormal hemoglobin, but we don't know what type.
But the yellow eyes indicates there's something wrong
Something
with
is
the
going on
kidneys or
with
the
it,
liver.
right. There's a Rubin, we call it bilirubin process that's going on.
Yeah.
And it's working very hard to get rid of certain things in the cell. The cells are breaking down at a speed that is
Wow.
amazing.
Yeah.
So as a result of that, the body's not able to release all of this chemical that is being released from the red cell, so it produced this yellowing of the
And the
eyes.
body's amazing.
Isn't it
trying to
amazing?
Compensate for a lot of different
It
things.
does,
There's
until
a
it just gives
constant
up.
fight going on in your body.
Exactly. And one of the most important fight is the spleen. The spleen will just stop working because it's just, you know, I'm sick and tired of all these cells coming through me. I'm just
Yeah.
going to shut down. And so as a result of that, we have sickle cell patients without any spleen. We call that autosplenectomy, where the spleen says, I am sick and
Autosplenectomy.
tired of all these damaged cells coming through me. I'm just going to stop working
Yeah.
and just quit.
Enough of this
It's
stuff.
enough of this.
Yeah. Wow. Once again, where can we go for more information? One of the wonderful things.
For more information about the event, you can visit my website. That's www.morrisaniaband.wordpress.com. You can hit us up on Facebook or Twitter. Facebook, that's Morrisania Band. Twitter, it's the same, Morrisania Band. Or you can just call me, 347-773-4922. I'm very friendly. I answer the phone.
Yes, you are. Thank you so much. Give her a big round of applause, everybody. Elisa Carmona and Dr. Sandra Dobson. No, clap like you mean it. There you go. At home, I see you. She's an associate professor and Q-Scan board member. Thank you guys so much for stopping by, all right?
Thank
We
you.
have to take a quick break, but stay tuned. We'll be right back with more Open. We're open next.